Hey everybody, I'm Shakisha Glass and this is Talk Feel Heal, a space for Baltimore to talk about the things we go through and find ways to get through. This is brought to you by the 988 Helpline in Central Maryland. Today we're talking about a different way to deal with addiction, specifically to drugs and alcohol. We're so used to talking about recovery as stopping use completely, but what if there were some other steps? I'm excited to welcome our guest, Dr. Burnett with Reach Help Services. Welcome, Dr. Burnett.
Hey, thanks for having
Tell
me.
me a little bit about who you are, what you do in the community.
Cool. My name's Malik Burnett. I'm an addiction medicine provider
Okay.
here in Baltimore City and around a couple places around the state. I take care of people with all different types of substance use disorder in the hospital and in the community, help them get into recovery.
Okay. And what is your title again?
I'm the medical director of Reach Health Services, which is an opioid treatment program on Maryland Avenue here in Baltimore City, as well as adjunct professor at the University of Maryland Medical Center, where I do inpatient addiction treatment.
Oh, so you got titles.
Got a couple
But
titles.
it's
There's
a
a few
similar
more, but we
thing.
won't go
You
into those
you
for the time being.
essentially help medicate those who are addicted to substances.
Yeah. Help
Okay.
them get onto medications that
Okay.
help them with their substance use disorder and ultimately get into recovery.
Wow. Okay. And this is, you mentioned, both in the community and in hospitals.
That's correct.
So when you think about addiction, your view or scope on addiction might be a little different from others, where some people may be more streamlined. You have a wider scope of addiction. But what does that mean to you? How would you describe it?
I think that addiction, um, I think actually it's a very narrowly defined thing.
Mm-hmm.
For me, I think a lot of people generally, um, place a lot of stigma on the concept, but
Mm-hmm.
conflate substance use with substance use disorders.
Mm-hmm. Mm-hmm.
But I think for me, people who struggle with addiction are struggling with life problems and using
Oof.
drugs to cope with those problems. And so, what we do in both the inpatient and outpatient setting is help those individuals deal with the physical withdrawal symptoms, and then, build structure and support for coping with, life adversity, so that they don't have to use substances as that,
Right.
crutch.
That's really good. I don't think there's too many people that like say I want to grow up and be addicted to substances. It's usually something
Right.
that, like you said, is causing them, hey, I need to deal with this. And so
Right.
now I got a whole nother issue or a whole nother problem. Sometimes, oftentimes with addiction, there's this fear of, especially on the road to recovery, there's this fear of judgment. How does judgment play into your realm? Like, how have you seen it? What do you know about judgment and addiction?
Yeah, I think judgment and, another way to frame it is stigma play a
Stigma. Yep.
significant role in our work. And it manifests itself in a couple of ways. There's, external stigma,
Hmm.
people, uh, you know, whether they're in the medical community or in your family
Yeah.
or, just in the community at large,
Hmm.
have a negative perception of people who are struggling with substances. But, uh, this is an accurate sort of framing.
Yeah.
You don't necessarily, I mean, addiction, generally, substance use disorders is a disease much like any other disease.
Yeah.
And we
Yeah.
don't,
Yeah.
or at least we've come a long way relative to how we look at individuals who are suffering from other chronic medical conditions, diabetes,
Yeah.
hypertension, cancer, HIV, AIDS, and so to the extent that we can put addiction into that bucket and look at it as a treatable medical condition, I think we'll do a lot towards helping individuals. But I think also another way that judgment and stigma plays a role is that there's this internalized negative
Mhm.
self-view
Mhm.
that
Mhm.
individuals have,
Mhm.
and they,
Yeah.
constantly ascribe negative behaviors to themselves because individuals who are struggling with substance use disorder, say, oh, it's just my addictive thinking, or,
Yeah.
I'm just a junkie at the end of the day,
Yeah.
and all these sort of frames
Yeah.
that are, really problematic from a self-image
Mhm.
standpoint.
Mhm.
And what, at least in the clinical setting, we try to do is rehabilitate people's sense of self-worth so
Mm.
that they, can embrace treatment and ultimately take the steps towards improving their overall life outcomes by, reintegrating themselves into the
Yeah.
community and relying on, their support systems to be able to get better.
Wow, that's really good. And I like how you mentioned the internal struggle. Oftentimes when we're dealing with life's problems that can lead to addiction, it can be things like anxiety. And anxiety is what you tell yourself. It's
Yeah.
the lies you believe. It's the worries that you have. Well, what if, what if, what if, what if, what if?
Hmm.
And so now we're coping and with these other mechanisms, but
Yeah.
it's like if you can get to the root of it and helping them, like you said, beyond the addiction part.
Yeah.
I also like the language, suffering from addiction versus addict, which is
Right.
a word that you hear in the world,
Right.
which comes with the stigma, which
Totally.
comes with the judgment, and no one wants to be called anything.
Right.
So there's that, and that can prevent you, from reaching out or wanting to get help.
Totally.
Even if you believe in your mind is true or not,
Yeah.
just the stigma alone can prevent you from wanting to get help.
Exactly. And you kind of alluded to this. There's a lot of mental health related matters
Mhm. Mhm.
in the field,
Yeah.
or comorbid sort of mental health disorders that
Yeah.
individuals with substance use disorder also have, and depression, anxiety are two
Mhm.
main
Mhm.
ones.
Mhm.
And I think at least what I talk with my patients about a lot is the importance of staying in the present.
Yeah.
Like I define depression largely as an inability to let go of the past, and anxiety as
Mm.
an inability to like let go of the future,
Ooh.
right? So to the extent that you can focus on the
Yeah.
present and
Yeah.
stay within the things that you can control right now,
Yeah.
very much in line with the kind of serenity prayer, God
Mhm.
grant me the
Mhm.
strength to
Mhm.
control the things that I can control and accept the things that I can't.
Lord.
um
And
you
you
know
deal with the rest.
right, exactly. So being in the present is a
Yeah.
very important thing that I think a lot of people who are struggling in general
Yeah.
can do in order to kind of regain a footing on their life.
That's really good. And I feel like I'm going to come back to that. What I want to ask you is, because you've seen this community, you've seen this in hospitals, I'm sure you've seen it and everywhere in between. You've probably have seen or heard so many different stories on how one comes to a point where they are suffering from addiction.
Yeah.
And it's not always the same story. What are some of the different ways that a person can end up here?
Yeah, I mean, there's a lot of different ways. A predominant way that we've heard as a pretty common narrative at this point in time is individuals, for whatever reason, experience some sort of medical or life injury, get started on prescription
Mm,
opioids, are on prescription opioids for an extended period of time, or to
yeah.
quickly get cut off by their providers, then have to transition to the street market for
Yeah.
their opiate dependence, and then that leads to long-term substance use disorder. Another major sort of pathway into substance use disorder is through experiencing adverse childhood
Yep.
experiences, like life trauma at a young age has a significant impact that very much increases your likelihood of being
Yeah.
or having a substance use disorder,
Mhm. Mhm.
something like 7 times more likely. So
Yeah.
that's another common pathway. People have unmanaged, unrecognized, and undealt with trauma.
Mhm. Mhm.
Uh, and, they find that turning to substances is their means of coping.
Yeah.
And then, there's the few individuals who start using these substances recreationally and develop some sort of dependence. And then
Yeah.
that dependence in and of itself leads them to make poor life choices that ultimately cause them to become or have defined substance use disorder.
And that's so real. And I think that's what most people who don't have the experience of addiction assume
Mm-hmm.
is that, oh, you must have tried it and now you got addicted.
Right.
And um, we don't often meet them with the empathy and the
Right.
understanding of like this could happen to anybody at
100%.
any time on any
Absolutely.
day, and it's so real. And I believe that most people have something that they have too much of, something
Mm-hmm.
that they are addicted to,
Totally.
and without the proper channels and the wrong situation happening, it could be any of us any
Totally.
day. And so I appreciate you just kind of running down some of the ways, just some
Yeah.
of the ways
Yeah.
that this could happen.
Yeah, I mean, my patients span the gambit. There's no characterization. They are check all the boxes for race,
Mhm.
socioeconomic status,
Mhm.
gender identity.
Yeah.
Every sort of
Yeah.
box that you can check. I've got patients in those
Yeah.
boxes. So like,
Mm.
this is something that I think is not exclusive to any group, although, there are, certainly in the media and lay press perceptions and projections of what
Yeah.
it looks like to have substance use disorder and certain, character types that are put out there. But
Mm-hmm.
what I can tell you from my experience is that, nobody's immune.
Yeah. And that's so real. There's this term harm reduction.
Yeah.
When we think about recovery, there's the old concept of cold turkey, stop everything. Not super realistic. And I'm sure every day is harder
Mm-hmm.
to do that.
Yeah.
With regards to harm reduction, what is it, and what are some ways that we can kind of encourage harm reduction while we're in this road to recovery?
Yeah, in general, I'd say harm reduction is a concept that, we work with people where they are and provide them
Yeah.
strategies to be able to reduce the, overt risks that they face doing their everyday activities, right?
Mm-hmm.
And so, in the context of substance use disorder, that looks like finding alternative means by which you can use substances in order to be able to reduce your risk of, skin and soft tissue infections,
Mm-hmm.
your risk of contracting infectious diseases, utilizing partners, not using by yourself,
Yeah.
carrying naloxone with you at all times so that, you can help somebody else who might be experiencing overdose, or to the extent that you're experiencing overdose, somebody can find your naloxone and save your
Yeah.
own life.
Yeah.
All these sort of strategies to preserve life is what I would describe it as a broad bucket
Okay.
on what we're doing in the context of harm reduction is ensuring that people live long enough in order to be able to get to recovery.
Ooh, and that's what I'm like. Give me one more day,
Right.
Lord. Yeah.
Right. Right. So, I think in a previous role, I'd served as the medical director for the Center for Harm Reduction Services for the state of
Okay.
Maryland. We at the Center for Harm Reduction Services, now the Office of Harm Reduction,
Okay.
renamed, uh, work to be able to establish syringe service programs across multiple jurisdictions in the state, oversee and ensure the distribution of naloxone, overdose reversal agent that helps save lives to all of these places, provide wound care services, provide
Wow.
drug checking services so that people can know what it is that they're getting from the street supply, because it's definitely not what you're being sold, right? And told is something totally different. And so, providing information and knowledge to people about the substances that they're exposed to in the community, and, ways that they can protect themselves is the goal of harm reduction. And,
Wow.
we're fortunate to live in a state like Maryland where these are things that are supported and sponsored by the government and provided in, spades to the community.
Yeah, that's great work, because and I'm sure it's needed everywhere, but it's
Absolutely.
definitely needed. It's definitely needed here.
Sure.
And I love the idea of valuing everyone's life so much that one more day is important. Like if I can just, it's not about where you are now,
Right.
but let's extend your life so
Right.
we can get you where you need to be, and you can get to a point of a full life. And I
Absolutely.
love that idea. You mentioned meeting people where they are.
Mm-hmm.
What, in your own words, what does that look like in plain words?
Listening.
Yeah, yeah.
Right. Like, I think a lot of the time, particularly in the medical community, you know, we'll meet with a patient, they'll begin talking about what it is that's going on, and then, they say a few buzzwords and you automatically jump to what it is you think they need.
Yep.
In reality, what they may need is nothing in relation to what it is that you think they need, right? And so being able to listen and understand, um, what somebody is wanting at that moment
Yeah.
is meeting them where they're at, right?
Yeah.
Like, certainly there are the overt major objectives of getting somebody to recovery that the outside person may be saying, oh yeah, we need to get you into treatment so that you can get into recovery. But that person may be hungry, or that person may need a place to stay. And, there's,
So they ain't trying to hear nothing
right.
else because they need a meal.
Yeah, in the
Yeah.
wonky, medical framework, there's the Abraham's Maslow's hierarchy of needs. But like, in reality, people want to have, eat, sleep, and be safe
Exactly.
before they think about any other
Yeah.
major goals and,
Yeah.
personal ambitions. So,
That's so good. That's so good. And this is a new term for me, and I'm a resident of Baltimore City. I see all kinds of stuff. I've grown up through all kinds of stuff. And it is encouraging to know that harm reduction is something that's being put at the forefront and is being prioritized, and people are being met where they are, because I've lost people in real life,
Yeah.
friends and family, to
Sorry for your
addiction.
loss.
And thank you. And I think the most important thing is, how are we getting better and how are we preventing this from continuing? And everybody's definition of recovery and addiction is not the same.
Mm-hmm.
So tell me, how do you see recovery, like, in your field? I know, again, we talk about it being cold turkey, but what else could recovery look like?
Yeah, I think recovery is definitionally dependent on the individual, right?
Mm,
So, people come to the table with varying degrees of substance use disorder,
yeah,
varying levels of severity of substance use disorder is
yeah,
probably a way to describe it. And let me just, for the sake of our conversation, define substance use disorder, right? And
yes,
when I talk about it, and the medical framework of it is life problems, right,
mm-hmm.
related to substances, right? And the key part of it is the
Mm,
life problems, right?
mm,
So, like, can you maintain a job, maintain a household, take care of your responsibilities, whether that be family, financial, or otherwise?
yeah,
Those sort of basic life needs, are you able to meet them? If not, and the reasons why you can't meet those sort of
mm-hmm.
things are predicated on substance use, then that is what is called a substance use disorder, right? And so then when we, now that we define the problem, what recovery looks like is the ability to accomplish those life, things, right? Whether that's
That's really
maintaining a
good.
job, maintaining a household, taking care of your family obligations, otherwise having some sort of financial viability. That's what the framework of recovery looks like. And, that may or may not include abstinence from substances, right?
Yeah,
Like, for a lot of people, it does, right?
yeah,
It requires that you stop using the substances
yeah,
completely. For some people, it may not, right?
yeah,
And so there's a continuum that exists, and it's important to be able to acknowledge that continuum,
yeah.
um, and, help. And this is kind of where we're talking about meeting people where they are,
Mm-hmm,
right?
mm-hmm.
And what they want to accomplish, right? Help people get to where they want to be and realize that there's not a timetable for that,
Mm,
right? Like,
mm,
it's not your timetable, it's that individual's
yeah,
timetable that we have to keep at the forefront, right?
yeah,
And at some point in time they will get to the place where they want to be at, and it'll be up to them to continue to want to advance their goals and objectives as they accomplish whatever is in front of them at the moment.
yeah. I think that's important. And as you mentioned, meeting people where they are, where do they want to be?
Mm-hmm.
We oftentimes will put our goals on other
Right.
people, especially our friends and our family members, the people we just want to see you better. I just want to see you.
Right.
I just want to see you better.
Right.
And I love how you worded that. I love how you said we are here to help you get where you want to be. And another thing, the way you broke down substance abuse, oftentimes we're thinking hard drugs,
Mm-hmm.
alcohol. But is this thing preventing you from keeping a job, from running your household, from paying your bills, from having a family, from functioning at
Right.
life?
Right.
That substance can be a lot of things.
Totally.
And so many people may not even realize they're walking around
Yeah.
with this
It
issue.
may not even be a substance, it may be a behavior,
Listen,
right? And so,
listen. Speak a little louder for the ones in
yeah,
the
right.
back.
So I mean, there's all
It
sorts of
may very well be a behavior.
correct,
It's
correct,
probably a behavior.
correct. I mean, at the end of the day, what we're talking about are all behaviors, but I mean, it may not
Mhm.
necessarily be some external
Yeah.
thing that you're putting in your body, right?
Mhm.
It may
Mhm.
be some way that you're comporting yourself
Yep.
that is preventing you from accomplishing
Yeah.
these basic things of being a productive member of society, right? And so,
Yeah.
how can we, as a community writ large, whether we're in the treatment community or in the general
Yeah.
community, help that individual be able to be a productive member of society?
That's so good. That's so good. Talk to me about the difference between recovery and survival.
Yeah, that's a big difference, right?
Yeah.
Like, I mean, that goes,
Because
it's
everybody, like,
kind
I'm
of
surviving. I'm
right.
out here. I'm alive. Ain't I? I'm
Yeah.
good.
Yeah. I mean, you're alive, and, then there's, the frameworks of recovery, right? So, like, this goes back to the question of meeting people where they're at, right?
Mm-hmm, mm-hmm, mm-hmm.
Certainly, it is imperative that we provide the support necessary to ensure people's survival, meaning that they live safely day to day, right?
Mm-hmm.
That is different in kind and form from recovery,
Yeah.
right? So, recovery is being able to thrive day to day,
Yeah.
right? Like
Yeah.
versus surviving and living
Yeah.
day to
Yeah.
day, you got
Yeah.
to thrive and advance your
Mhm.
goals and
Mhm.
objectives,
Mhm.
meet your daily obligations, right?
Mhm.
That's what recovery looks like
Okay.
versus, just trying to, make sure that you wake up every morning and you're breathing, right?
Yeah.
That's,
Yeah. Yeah.
breathing, eating, feeling comfortable, having some sort of shelter and protection
Yeah.
from the elements, right? That's
That's
surviving,
survival.
right?
Yeah.
Recovery is kind of the next level, I would say, right? Being
Mm.
able to, interact with your environment in a positive way, not necessarily be subject to, difficulties from your own actions and
Yeah.
behaviors, right? Like being able to just, be a part of the community at large
Yeah.
in a positive way.
That's really good. That's really good. And I think about all the different behaviors that come with recovery and all the different spaces that you're in and why it is important to walk all the steps and
Mm-hmm.
not just aim for survival.
Mm-hmm.
Because you can, all right, last night didn't take me out.
Right.
Cool. I didn't been in some places where I thank God that last night didn't take me out,
Right.
but I couldn't live like that every day.
Right.
We can't live like that every day, and so just being just mindful of just the way we're navigating. And one of my things with being able to experience this and have this talk with you is while I'm not a professional in that way, I want to make sure that my language is appropriate. I want to make
Sure.
sure that, I'm navigating these conversations because I'm having them, and I know people, and
Yeah.
I hear I'm fine. I
Right.
hear, don't you see me living and breathing? If God wanted to take me out, He'd have took me out already. Just
Yeah.
anything,
Yeah. Yeah. Yeah.
But
Yeah.
getting the mindset to shift
Yeah.
from, all right, I no longer want to survive. I want a full life. I want to interact with my environment. I want to
Right.
give something to the world. I
Right.
want to do that thing I love now, that hobby that I gave up on, or
Right.
that kind of thing.
Yeah, I think there's a large sense of, particularly when you get into the framework of issues related to substance use disorder, there's this like sense of pride and self-reliance, and like you got to do it by yourself. Like,
Mhm.
oh yeah, I
Mhm.
started using
Mhm.
substances by myself, but and so therefore it's on me to be able to pull myself out of this. But
Yeah.
in reality, you actually weren't using substances. You might be physically doing the substances by yourself, but
Mhm.
like what is actually probably happening in the background is that there's some problem within your support system and community
Yeah.
that you are not necessarily wanting to deal with,
Mhm.
and so you're pulling yourself back from that community problem or your interactions with that problem within the community
Mhm.
and resorting to coping or taking
Yeah.
your mind off of it by
Yeah.
using substances. And so, what does
Mm.
recovery look like, right? It is actually reintegrating yourself into that community and dealing with the issues that are at play relative to
Yeah.
that, what may have taken you out in the first place, right? Resolving those issues and then relying on your community to be able to get you back up on your feet, right?
Yeah.
That is all. Recovery is inextricably linked to community.
Mm.
Right, those things are
Mm.
part and parcel for one another.
Yeah.
People who sustain recovery have support systems of community.
Yeah.
Right? These things are, necessary to go together. And when we're talking, and I take care of a lot of people with substance use disorders, a lot of them recover, right? But how do they recover? They recover because they have reintegrated themselves into the
Yeah.
community that they were once a part of prior to using substances.
Wow. So with reintegration, do you have any specific steps or recommendations for a person that maybe they're just coming out of rehab or just
Mm-hmm.
coming out of a detox or thinking about going into one, but afraid of the other side? And
Right.
we know, this is not something we can do alone. What are the communities that people can go to get that type of group support?
Yeah, there's a lot. I think, particularly, we're fortunate in the city of Baltimore to have a lot of different treatment options,
Mm-hmm.
whether they're recovery, housing, uh, opioid treatment programs, hospital-based substance use disorder services,
Mm-hmm.
uh, medications for opiate use disorder, which you can get even from your primary care doctor at
Wow.
sometimes, right? So there's a lot of doors to be able to start the journey, right? And
Mm-hmm.
so what I would say to most people is start where it's most comfortable for you.
Yeah.
Whether, I mean, even in the harm reduction space, right? You could just be going to the syringe service program, your local, drug checking.
Mm-hmm. Mm-hmm.
They have mobile units, right? And so just engaging with people who have a vested interest in your well-being
Yeah.
is the place to start, right? And so they probably don't want anything from you other than to help you get to the goals that you want to,
Yeah.
particularly in the framework of the harm reduction community, and to a greater or lesser extent the treatment community. We're just here to be able to try to provide some support that
Gotcha.
you need in order to be able to start your recovery journey.
I like that. And I love the concept of being able to call 988 and get somebody on the line at any time, and they can give you
Yeah.
resources and direction to these resources.
Yeah.
But what if I'm a person that I'm like, I recognize I might have an issue, but I'm not ready to stop. Like, I ain't stopping no time soon.
Right.
What advice, what would you give to either that person or to somebody that is in life with that person?
What I would say to an individual who's not ready to stop, and we talk with a lot of individuals like that in the treatment community, is, well, help. Maybe it's helpful for you to identify what it is that you are ready to do, whatever that
That's
is,
good.
right? And whether that's just learn about the information and become better understanding of the options that are available to you when you are ready to get
Yeah.
help, or just talking with other people who have gone through the journey that you're going through, right? There's nothing new under the sun, right?
Yeah.
Your experience is certainly unique to you, but it's certainly not one that you can't draw on other people's experiences to
Yeah,
help
yeah,
shape
yeah.
your
Yeah.
understanding of your own experience.
Mm-hmm.
And so figuring out what it is that you would like to do next as a first step, right, relative to this issue, right? Because it's going to be an
Yeah.
ongoing issue until you start to address it, right? And so, what is the first thing that you'd like to do? Once you figure out what that is, seek out the opportunity that is necessary in order to accomplish that, right? And then what you're doing is building momentum. When I talk with patients in the clinical setting, I say, look, you're here in treatment, and what it is that we're going to do is practice getting good at not using drugs, right? Like, you
I
practiced
like
for a
that.
long time, getting good at using drugs, getting good at finding drugs, getting good at recovering from drugs. All of this was
Yeah.
practice, right? And what we're going to do now is practice getting good at not using drugs, getting good at not finding and hanging around the people who are using drugs, getting good at finding time or finding things to occupy your time that would take the place of the time that you were using to use drugs. Finding and practicing what recovery looks like, whether that's participating in your community and meeting your daily obligations, getting back on your feet relative to work and employment. All of those sort of things are practice by going to meetings and building up your support system, right? All those sort of things are opportunities for you to be able to get good at not using drugs.
That's really good. I like the word practice
Yeah.
because practice lets me know I'm not going to get it the first time
Right.
or the second or the third. And it's good. But each time I'm going to get a little bit better. It's going to get a
Exactly.
little bit because that's how practice works.
Exactly.
I've never heard that terminology.
You hit the nail on the head. That's exactly how
Yeah.
I frame it with for our patients insofar as it encompasses the concept of relapse.
Yeah.
Right? Like, so to
Ooh,
the
it's
extent,
already accounted for
right.
it.
So if you're practicing and you relapse, that's just one bad day.
Yeah.
Right? Like, you don't
Yeah.
have a lot of the time patients will beat themselves up because they're like, oh, I relapsed, and then they'll say, well, if I relapse, then I can't do it, and therefore I'm going to keep going down the road of
Yeah.
ongoing substance use, right?
Yeah.
And what I try to explain in the framework of practice is, look, relapse is accounted for because that's just one bad day of practice, right? You now know what it is
Wow.
that went wrong on this day of practice and what steps you need to make tomorrow in order to avoid the same mistake, right? Like, it's relapse is one day, but making a decision to keep making the same mistake over and over again is
Yeah.
returning to
Yeah.
substance
That's
use.
not relapse.
That's
That's
not
returning. Yeah.
relapse.
Yeah.
That's
Yeah. Yeah.
returning to substance use,
Gotcha.
right? And so
Gotcha.
it's important that you allow yourself the opportunity to be able to make mistakes,
Yeah.
but learn from the mistakes in real time and then make corrections the next time,
Absolutely.
so that you don't make the same mistake again.
Because if I have a bad practice, I'm like, okay, maybe I'm not flicking my wrist.
Right.
So now I'm flicking my
Right.
wrist,
Right.
So
And then we off to the races,
that's
making it
really good.
rain.
That's really good, and it's good language differentiating practice and what that. So like, if you're showing up for practice, you understanding like, okay, well, the last time I relapsed, I was around this person, I
Right.
was at this place, I was thinking these thoughts, I was feeling these feels. So this time when these things happen, I can try
I know how
something
to do
different.
different.
Yeah,
Right.
that's really, really good. Now, what if it's not me?
Right.
What if it's not me and I can't control the person? Maybe this is my sister or my brother, and then they're like, hey, we all see it. We see something's happening, but they're not ready. What tips for me? Or, is there, what can we do? Because oftentimes we be trying to fix them and we can't fix them.
Yeah, well, first acknowledging that you can't fix them is
Yeah.
important,
Yeah,
right?
yeah, yeah.
Like, you got to let that pressure off yourself,
For
right? As the
yourself.
person
Mm-hmm.
who is observing the person that you
Absolutely.
love struggle, right? Like, you can't beat yourself up about the fact that they're not getting better, right? Under the timetable that you want them to
Yeah.
get better under,
Yeah.
right? And so, just being available and supportive of that individual and just trying to be an open ear, somebody that they can come to when the time is ready, right? And that's hard, right? I'm
Yeah.
not even trying to pretend, or it's much easier said than done what it is that I'm talking about,
Yeah.
right? Because you love them and you don't want any bad things to happen to that person,
Mm-hmm.
right? And so when you see them in harm's way, you're like viscerally driven to try to
Yeah. It's
prevent
like,
the bad from
ooh,
happening.
yeah, if I could just.
But unfortunately, you know, everybody is an individual and
Yeah.
responsible for their own
Their own
actions
self.
and have to deal with their own consequences, right? And so the best thing that you can do as a person in that individual's corner is just be there, to be supportive and open, not necessarily intentionally not being exploited, right? You can't
Yeah.
enable or be exploited, right?
Yeah.
Like that's
Yeah.
hard too.
And can we talk about that real
Right,
quickly? So, like, again, we talk about loved ones. How
right,
do we say, how can I be there?
right.
How can one be there and still say no and still set boundaries? Like, what's the language?
Yeah, I mean, patience is the overarching principle in
Yeah.
this sort of
Yeah.
interaction, right? Like, I think a lot of times, particularly with loved ones, we tend to, get, in our feelings and in our
Mm-hmm.
emotions and react out of emotion versus out of, rationality. And you got to understand that the framework of this disease is one that, is a impulse driven disease, right?
Yeah.
So people are going to make impulse decisions
Ooh.
that are not necessarily in the framework of rational. And
Mm.
that's part of the nature of
That's
the
a great
problem,
point.
right? Like, and
Yeah.
so as the outside observer or the family member looking on, you got to understand that this is the, manifestations of the disease process for
Mm-hmm.
that
Mm-hmm.
person, and appropriately set boundaries to keep yourself safe,
To keep
right?
yourself safe.
And then also to ensure that the other person knows that while you're not necessarily going to do this thing that you feel is going to enable their behavior that you don't want them to do, that doesn't mean that you don't love them and that you're not open to being there for them when they're ready to,
Mm-hmm.
start taking steps towards recovery,
Mm-hmm.
right? Like a lot of the time, it's kind of like all or none for the family members that are dealing with
Yeah.
people in addiction.
Yeah.
It's like
Yeah.
either this person's gonna get better, or I'm not having
Yeah.
anything
Big
to do with
culture
them,
of all or nothing.
right? And so
Yeah.
it's like I get that, and I can understand you might be protecting yourself from your
Mm-hmm.
own emotional
Mm-hmm.
harm,
Mm-hmm. Mm-hmm.
right?
Mm-hmm.
Which is totally real and totally appropriate, and
Yeah.
sometimes that's what's necessary,
Yep.
right? But you know, at least keeping an open mind frame to the extent that it's possible to do that, such that the individual who is experiencing the substance use disorder knows that they can go back when
Yes.
they're ready to
Yes.
be able to start making inroads towards
Yes.
recovery, right? And understand that that's not a straight path for that person, right? Like
Yeah.
today they may be willing to make some steps towards recovery, and then certainly something might happen between today and tomorrow where they're not necessarily as willing.
Mm.
But
And not taking offense,
right, that's not reflective of you.
not judgment,
Right.
not, but you said yesterday, or what
Yep.
happened last week you was sad, and now this week you good, so now
Right.
you don't want to get help. Yeah, all
Right.
of that I think needs to be removed from the equation.
Right.
I think families, and I've seen families be torn apart because we're not treating it like a disease.
Correct.
We're treating it like it's a choice.
Yeah.
Like you wanted to come steal this stuff. You
Right.
wanted to lash out. You meant to leave your kids like it was on purpose,
Right.
and we know that that's not the
Right.
case.
Right.
Just like you wouldn't choose to have any other disease, you're not gonna choose
Yeah.
to have the disease
Yeah.
disease of addiction. And I
don't-
just appreciate you bringing it down.
We don't throw people out who have recurrence of their cancer, right? Like we're not here. If you're in remission with cancer, and
Ooh,
then your cancer occurs, we're not like, oh
I'm
yeah,
done
you
with
got
you
to
and
get
that
out there. Yeah,
cancer.
yeah, yeah. This
Yeah,
cancer thing
yeah,
is too
yeah.
much. You got to go, right? Like we ain't doing that. You know what I'm saying?
That's
So
perspective. And that's what we need. We need more perspective.
Yeah.
Because again, even with TV, like let's be honest, so
Yeah.
many black households were raised off black TV.
Totally.
So it's like you do certain things, you gotta go. You
Right.
turn 18, you gotta go.
Right.
You don't follow my rules, you gotta go.
Right.
And now that stuff, and that's not even talking about the stuff that's happening in the house.
Right.
So in the house, outside of the house, there's so many things that could end us up. On a substance
Right.
or behavior
Right.
of some sort.
Right.
So I think the more we can pull away from that stigma again, those expectations, that perspective, that old perspective.
It's critical, right?
Key.
You gotta always, like you said, have perspective on the
Yeah.
situation. It's hard, right?
Yeah.
Though you're caught up in the emotions, and that's a real thing, right?
Yeah.
I just want to keep coming back to that.
Mm-hmm,
Like what we're talking about are the best practices.
Yeah.
But in
In
reality,
real life.
that is difficult, right? And like we gotta acknowledge that reality. But as difficult as it is, ensuring that you can try your very best
Yeah.
to maintain perspective and exercise patience with these individuals, right? That you love, right? Like if you love somebody, your patience should be reflective of the level of
Yeah.
the love that you have, right?
Yeah.
And, certainly make sure that you're protecting yourself, but in the same vein, allow the individual to be able to get on their journey back to recovery as long as that might take.
That's so good. I'm never gonna forget the cancer analogy, cause and it insert any disease. It
Yeah.
could be diabetes. It could be
Right.
anything.
Yeah.
Like you're not gonna fault a person for a
Right.
disease that they're suffering from, and a lot of times it's not something that we choose. Most diseases aren't
Right.
something that we choose. You
Right.
know.
Right.
So yeah, I really that's perspective. I thank you for that.
Yeah.
We think about this 988 helpline.
Yeah.
It's a free line. It's confidential. People can call it any time of the day. Do you know of any stories of anyone who's used it and outcomes without messing up that confidentiality?
Definitely. Without divulging or violating anybody's confidentiality, I know a number of people who have engaged with 988 both via phone and particularly importantly via text, right?
Yeah,
Because a lot
yeah.
of people, particularly in our millennial and under generation,
I was gonna say I'm not calling.
Yeah, I mean exactly. You're not out here
Yeah.
trying to get on the phone and talk to anybody, right?
Not
But you
about
can-
my problems.
Nah,
No.
that's hard, right? That's a high barrier. I mean, just as a high barrier to call people in
Period.
general today or in this day and age, right? So, like, you prefer to shoot a quick text,
Yeah.
a little bit less personal. But, utilizing 988, you can send texts and people
Yeah.
will text back, right? They're not going to call you
And
after
it's
you
people
text.
texting you
Right,
back.
exactly.
It's not like AI
or
machine
anything
or
like that, right? Like you're here interacting with a person in real time. And,
good.
again, going back to the core of community and human interaction, like in the, moments of desperation where you feel like, all is lost, having that individual to be able to reach out to is critical for your survivability. And ultimately, when you survive, you're able to recover, right? Because you got to survive first.
You got to
before we
survive
get
first.
to recovery.
You got to, and what I love about learning about 988 is it doesn't have to be what some would deem a major crisis.
Right.
It could be something preventative that could stop you from now trying a coping mechanism.
Right.
So
It's never too early
it's
to reach out to 988.
It's never too
Right? Like you're like, oh no, it's got to get worse. No, it's never too
yeah,
early.
and sometimes we think that, like, we
Right.
perpetuate this thing where,
It's
like,
not that bad. I
it's
can
not
deal
that
with it.
bad. I mean, at least this didn't happen, or
Right.
at least that didn't happen. But
Right.
no, like, it's never too early. I like that.
Right.
I like that. As we wrap this up, is there any final thoughts? Is there anything that coming from you, and I want you to look in that camera?
Yeah.
They may have heard it from their friends and their family, but you, the specialist, you, the one, if you're the only voice they ever hear, what can you give to someone who may be struggling with addiction, know someone struggling, maybe afraid to reach out?
Yeah, I would say there's help out there, right? You can definitely recover. Most people recover. If you are interested in using medications to be able to get better, those medications work. There's, a fair amount of stigma related to methadone and Suboxone, which are two medications for opiate use disorder. I haven't seen, or pretty much all of the things that people say about methadone and Suboxone on the street are totally not true. And so,
I needed to hear that.
yeah, I think that, if you're serious about getting better, reach out for help,
Yeah.
right? There are people out here waiting to help you. And so, whether that's utilizing 988 or seeking help in the treatment community, or even if you're not ready to get into treatment, just going and, getting some strategies under your belt such that you're not doing as risky
Mm-hmm.
behaviors as you might be doing now, is a step in the right direction. And, it only takes that first step to be able to get on the recovery journey. And, each day you're going to be able to make more progress and, ultimately you'll get better. So that's what I'd say.
That's so good. That's so good. Thank you so much. Thank you for answering my questions,
Yeah. Thank you for
for
having me.
being here. Thank you.
Yeah. Cool.
And then we'll just